Okay, so I hit on a lot of the things. Oops, sorry, gone from chapter one, to chapter two now. I hit on a lot of the things from chapter two in the first video, but let's just go over that real quick. Um, chapter two talks about um, the, the critical thinking and health assessment. So that's a very intangible idea, but critical thinking and health assessment. Um, and of course, as people get more proficient at assessing, they expand their knowledge and their expertise, and this hopefully becomes easier. But health assessment, chapter two, critical thinking. So one of the first things that they hit on is that old CARD acronym, which again stands for onset, where's your pain, location, the duration of the pain, characteristics. Is it dull? Is it sharp? Is it radiating? Is it, on and off again? So what else goes with your issues? Here we're talking about associated manifestations. So when my leg hurts, my foot swells, what else? Associated manifestations. All right, relieving factors. Like if I sit down, my leg no longer hurts. So relieving factors. And then T, which is treatments. So what have I done so far to help with my leg hurting? All right, so again, this is how we specify information, how we can clarify what the patient's saying, and come up with a pretty detailed explanation of what the chief complaint is. All right, so that's old CART. The other one that they hit on is that ADPI process. And of course, we all know ADPI because that's a nursing process, and we've gone through it several times at this point. But when we're talking about it in relation to health assessment, let's go over that a little bit, okay? So we have, of course, A, which is assess. All right, something that you don't necessarily think about, and according to the text, this is what they're related to health assessment. So some of it's therapeutic communication. So when you do the assessment, you're using therapeutic communication, that opening to close, that allowing for pauses, allowing for emotions to go through, dealing with the angry patient. That's a therapeutic communication. Assessment is subjective and objective. Why? Because subjective. That would help. All right. Subjective, it's either coming for the patient or somebody else, and that is where we're getting that health history from. You're going to get, of course, you're going to get part of that in the interview as well, but some of it is that subjective information. All right, objective information is their vital signs is this. I observe this. Their foot is blue. So that's objective information. And then clustering of data. So you're going to get this whole spew of data and being able to assess and cluster the data into symptoms or regions so that we can make connections. And that is part of your critical thinking process, and we'll break it down a little bit more. D. All right, so normally we're going to figure out the problem. What is the problem with the patient? And of course, this is based on assessment. And again, remember, assessment is a bread and butter of a nurse. That's going to be something we continually do, is continue to assess, continue to implement and evaluate. The diagnosis, remember that the diagnosis is not the medical diagnosis, is not that they have Hep C. It is the patient is having an emotional crisis because of their diagnosis, and this is what we're going to do to try and help with that. Or they're no longer wanting to eat because of depression related to their diagnosis. This is how I'm going to try and fix the anorexia. So, diagnosis. Nursing diagnosis. And that one's pretty, based on assessment, pretty standard there. All right, planning. Remember, set long and short goals, and this has to incorporate the patient into this. All right, and implementation. So this is going to be based off that nursery diagnosis, and we'll come up with ways that we can implement. Maybe it's as simple as going back to preventative measures, or maybe it involves other aspects, education, things of that nature. With our intervention, and evaluation. And evaluation, again, it confirms the relevancy of the nursery in the healthcare setting. All right, that evaluation says, yep, I fix their anorexia by putting them in social situations to help with, whatever the case may be. But it gives the nurse value, and of course, it's something that we're going to continue to reassess so that we can get the best outcome for the patient possible. So the best state of health. So these are pretty clear cut, but think therapeutic communication, subjective and objective, and clustering data for assessment. Still, it is assessment, and we used that process several times already. So, ADPI. All right, so far we've got old part, we've got ADPI. 6 facets we reviewed in chapter 1. So steps in critical reasoning. So there's several steps, and I'll break them down a little bit. The steps in critical reasoning, clinical reasoning, is and I'm going to write it like steps. We're going to identify abnormal or positive findings. So if I test you for MRSA and you have MRSA, then it's a positive finding, right? Clustering. All right, and these are all going on in the nurse's head as you're doing the assessment. Interpreting, hypothesizing. This is a lot like the scientific method, but hypothesizing and developing. So the text basically says, and again, this is all something that's going on internally with the nurse as she's doing the assessment, or he or she. But 3 ways that we generally go through this process. Patterns. So how can I make this? Is there a pattern? Developmental, and then application of basic clinical science. So evidence-based practice, science. So those are the 3 ways that nurses go about going through this process. Okay, and this process is pretty much, again, back to CIS. We are investigating. We are trying to come up with, hey, who took out Miss Purple in the living room with the candlestick. All right, so we are trying to figure that process out by making connections, by categorizing things into different regions. And it could be something, like, okay, this is obviously an upper abdominal issue, or it could be really complicated and you have to really look for those connections, or it could be more than one issue. So these are the ways that you're going to try and reason through that. So again, identifying positive finding, cluster data. It could be the body, region, or system. So it might be, maybe it's affecting, your right arm and your left toe, but it might all relate back to your endocrine system. Interpret what could cause it. All right, so what can cause somebody's left arm and right toe to hurt at the same time with throbbing pain? All right, maybe we're looking at circulation problems. So you're going through and you're trying to interpret this information. Your hypothesis is where I'm going to say, okay, I think it's due to poor circulation. And you draw on the knowledge that you have. From there, you're going to develop a plan. So patient needs to agree on the plan. Again, I hit on that a couple times, but the patient needs to agree on the plan and be included in the plan. Because, of course, if I come up with this plan and the patient's never going to do it, then it doesn't really help at all. So as we go through this, we're also going to develop a problem list. Problem list is basically all the issues that the patient has. I'm erasing this. And that's pretty abstract because, you know, it's not something that somebody can, it's something that's being conducted internally. So it's a little bit abstract and time to go through that reasoning process. But the problem list, and you can find this information on, I had it tagged for us. You can find this information in the book on page 24. Alright, so the problem list is basically everything that's wrong with the patient. Alright, so from I have high blood pressure, my toe hurts, you know, whatever's fine. Now you, self-esteem, and I'm going to continue on this just to, and I can't breathe. Okay, so I'm looking at this problem list, and through the problem list, I've got to, one, figure out what is the most important. And again, so there might be concerned about this toe hurting, but at no point is that really going to be life-threatening. Of course, most receptive. But anyways, in comparison to the other things, okay, that might not be as important. The can't breathe is far more important. So we're going to look at that. Your high blood pressure might be you can't breathe, and this is going to take some judgment here. Oops, that's not what I wanted there. So this is going to take a little bit of judgment, but you're pretty much going to figure out, hey, this is the most important, this is the least important, and this helps us, one, so that we can make sure that we have a checklist to go by and check up on the status of the patient, so that we can make sure we're not missing anything, so we can address all the chief complaints, the issues that the patient has. But it helps us gauge where we need to go and how we need to prioritize our care, which is important because you'll have, of course, more than one patient. You also can use this to go back and find that nursing diagnosis. And remember that health maintenance is a huge thing that they're including in the problem list, so health maintenance. And that goes back to, are you getting Immunex? Are you wearing your seatbelt? Are you exercising? Are you eating right? And there's several different ways to separate these, but you can separate it from active and inactive problems. So maybe my blood pressure is no longer, and now I got issued a beta blocker, and it's no longer bothering me. So maybe it's an inactive problem at the time, but I still have the can't breathe, which is active. So you can separate it in different ways. So that way you can take care of the most important things first, okay? And that's the problem list. And again, you can find more information on that on 24. The nursing process, we've gone through that. And there's principles of test selection and use that has to do with reliability and validity and sensitivity. Not going to be hit on quite as much as far as the test is concerned, because it's a little bit blurry as to what exactly it's talking about. Reliability, like how reliable is the information. Validity, does it back up my hypothesis? Sensitivity is it going to clearly identify what the issue is with the patient? So if I test it, is it going to tell me it's just bacteria, or is it going to be like, this is the exact bacteria infecting this patient? And then specifically, that has to do with, is it extremely specific in diagnosing issues? Alright, and that has to do with the test selection. So chapter 2 is quite a bit lighter than chapter 1, or the rest of the chapters in whole. And a lot of it has to do with developing that nursing, the problems, problem list, and the clinical reasoning, which has to do with how can I correlate things? How can I help identify issues? You have to figure out, it's about figuring out patterns so that we can try and come up with a nursing diagnosis. And that is chapter 2.